Out?
Yeah, go ahead.
Okay. So the next topic that I was asked to just kind of address, and we'll have about 5 minutes, and I'd like to open this up pretty quickly to question and answers. But the broad topic is why we can't assume our progress is sufficient in the changing drug scene and its implication on treatment approaches. And we could go in a lot of different directions with this, the methamphetamine increase, but what I want to focus is really the era of fentanyl and how that has impact, especially in the acute withdrawal stabilization process. And just briefly to lead into this, I'd like to reference a recent article that was in the Journal of Addiction Medicine in January of this year. And it was titled, "A Plea from People Who Use Drugs to Clinicians." It's pretty powerful. New ways to initiate buprenorphine are urgently needed in the fentanyl era. And I'll just read a brief part of that abstract. They reported, in the fentanyl era, members of the New England Users Union and the Portland Users Union reports encountering precipitated withdrawal, being unable to stop using full agonist opiates, fentanyl, for a required period of time, and difficulty initiating this medication that could offer them more stability and life-saving treatment. So the practical concept here is several years ago, we had a heroin epidemic, and buprenorphine, commonly known as Suboxone, was commonplace and could be done with a relatively low skill set. It's changed, the scene has changed, and with fentanyl it's much more difficult because fentanyl sticks around longer, it takes longer to clear. And then as you start to do the induction process with a buprenorphine or Suboxone, a lot of times you'll kind of walk onto the fentanyl and create a very unpleasant situation, precipitate withdrawal. And unfortunately, once somebody has experienced this, they may be very hesitant to revisit the concept of initiation of Suboxone again because of this experience. So one of the initiatives we're doing in Ulster County is actually creating a survey along with Healing Community Studies to ask people who use drugs what's their personal experience. And I have a copy of the survey I could pass around later. But really, it's amazing when you don't ask clinicians, but you rather ask people who have real life experiences, the difference in the response patterns. So anyway, I do work at an inpatient facility, so we see several patients on a daily basis coming in with acute opiate withdrawal syndrome, and I feel like I have some experience with how this is changing in the landscape. But anyway, if there's any questions, I'd be more than happy to try to give answers to it.
Are there any questions in the room? We'll start with the room about this changing drug scene. Yes. Repeat the question.
A great question Julia asked. Is there anything that there is no fentanyl in? The short answer, no. Over the last couple of years, we've just seen an increasing number I also work in the medical examiner's office, so on fatalities, opiate fatalities, the toxicology screen, and patients coming in for treatment. And a year ago, I'd say 50% of all opiates had fentanyl. At this point in time, it's 95% plus. The scarier part is probably over 50% has no heroin in it. It's pure fentanyl.
Wow.
So over 50%, and this is just a rough gauge from looking at patients coming in on a daily basis, they're using pure fentanyl, and basically 100% is cut with fentanyl of the opiates.
And Kurt, does that include, I'm hearing that street marijuana is being laced with fentanyl. Are you seeing that?
I can't say I'm seeing it. Every now and then there's a toxicology that you have a hard time to explain, and you may speculate that's the case. I think there's a difference of opinion on that. So I wouldn't go there at this point in time to say that street marijuana has fentanyl in it. I think it's starting to emerge as more urban legend than facts.
Okay. Do we have any questions online, Tiffany? Great. Well, I think it speaks to the importance of us all being vigilant. I'm sure the police here are seeing the impact of the fentanyl that's in the drugs and how it's so much stronger. Even carfentanil.
Carfentanil. One of the issues, when we speak of fentanyl now, and I was saying fentanyl, which from a pharmaceutical grade is something that's been researched extensively. But now when we talk about clandestine labs creating analogs of fentanyl, carfentanil, it's a different creature. So we really don't know. That's why we're asking patients.
Yeah.
You tell us, how long does it last? There's no pharmaceutical company testing the duration it takes to clear this. And then from a practical point of view, how do you transition these people? How do you stabilize patients if you're struggling with a buprenorphine, the Suboxone, to stabilize them? So we have to look at alternative clinical pathways to do that.
Great. Thank you so much, Kurt. Thank you. And I'm very grateful, and the people who see you, I know, and Lucinda are very grateful for your presence in our community and for what you do. So one of the things that the coalition has really jumped on in the last year has, I'm sorry?
Oh, I'm just showing you just the
Okay. Is a harm reduction approach. Now,